Welcome everyone to today's webinar, Break the Cycle, How to Put an End to Recurring Denials. I am Molly Gamble with Becker's Hospital Review. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be made available after the event. You can use the same link you used to log in to today's webinar to access that recording. At this time, I am pleased to introduce our presenters. Linda Perry-Clear is a product line director for Avality's provider business, where she is responsible for the strategic planning and execution of the Avality RCM roadmap. Before joining Avality, Linda managed back office operations for several provider offices, where she was responsible for coding, AR collections, authorizations, referrals, payment posting, and the check-in and check-out processes. She also managed a practice management conversion. Linda gained clinical experience as a hospital corpsman in the U.S. Navy. Jason Yonkman is the director of the service operations for Avality's provider business. He is responsible for client success and overall support operations. Jason has over 20 years in healthcare IT and leadership roles, working for both national health plans and practice management vendors. At this time, I am pleased to turn the floor over to Linda to begin today's presentation.
Thanks, Molly. We're excited to talk to folks today about breaking this cycle and putting an end to those recurring denials. So we're just going to jump in and get started. So first we'll start with denial prevention. And really, we're going to talk about why manage what you could be preventing. And it's important that we level set what is a denial, what are we really talking about, and it's that decline of payment from a payer when it's expected. There's different types of denials that you could be addressing, whether they're hard or soft denials. Those hard denials are things that would require a write-off or really considered lost revenue and would require an appeal to recover those dollars. The soft denial is something that you can typically take action on, and refile a claim doesn't require an appeal. There's other categories that you can look at around denials. Was it preventable? Is it avoidable? Clinical, administrative, lack of coverages. Those are other categories that you can use when you start bucketing and looking at the work that you have in front of you. We start looking at the industry itself and where the waste is around denials. So there's some numbers here, really big numbers, and we look at them, $40.6 billion on administrative complexity. That number includes working denials. And these are numbers from CAQH and MGMA. When you think about the amount of time that it takes someone in your office or your organization to actually work the denial, MGMA estimates $25, 71 minutes working a denial. Now this number is actually sourced from 2014. There's not a lot of newer data on that, so we know that's a conservative number in working a denial. $118 per denied claim to appeal, again, an MGMA number that was referenced, but is a little bit older on the data map. We want to look at the typical top denials: duplicate claims, coordination of benefits, medical documentation, timely filing, authorizations, or referrals. So really, what is at the top of the list may vary by the type of organization that you are, but it's the usual cast of characters. So as we go through this, I want you to think about these buckets and whether duplicate claims is number 1 or 3 on your list. This strategy that we're going to review with you will help in whatever order it falls on your list. We're going to talk about a little bit about the impact of denials to the business. Of course, first thing that comes to mind is with regards to revenue. There are multiple industry sources that reference 80 to 90% of denials being avoidable. And there's no question that addressing denials can have an impact on your bottom line. But the one area really that may not come to the mind immediately when you start thinking about the impact of denials to your business is patient satisfaction. It's important to know that patient satisfaction can be greatly impacted by denials, that typically patients see it as an issue with the provider or the facility doing the billing. It can plant that seed about the validity of what the patient owes, and can lead the patient, in the worst case, to seek care from other providers because they don't feel like that they're going to get billed correctly. There's been some surveys done about, what are the top drivers that are getting folks to look for analytics tools to help them manage their revenue cycle management. And the things that come to the top of the list are around flagging potential denials before they occur and identifying inefficiencies. So when you think about that, those things are what are driving us to go to this area to focus on denials, denial prevention, and looking at things to reduce inefficiency around the revenue cycle and flag those potential denials before they occur. So what we want to share with you today is called the countdown method. And the countdown method is really just a focused, proactive, but most importantly, repeatable approach to preventing denials. So let's dig in and talk about this a little bit more. The countdown method is really step 4. Identify your top 4 denial categories. Step 3, focus on 3 reasons that cause that denial. Step 2, implement 2 options to address those issues. And then step 1, apply 1 measure of success. So the question really becomes, why would you keep managing what you can prevent, right? So let's get started. We're going to start with step 4, identifying your top 4 denials. You want to get a lay of the land. Take a look at the analytics tools that you have available to you, either through your clearinghouse partner or your practice management or HIS system or your system of record. But really you want to run report on the top denials for the past 60 to 90 days. And you want to look at that period from 60 to 90 days because a longer look, especially in this past year, if you were looking at a year-long picture of your denials, you may not actually be focusing on the most current issue or an issue that may have resolved itself. For example, in April or May, you may have had a lot of denials around invalid codes related to COVID testing or COVID diagnosis or treatment of COVID patients. And that may be that payer systems weren't up to date. Those claims got reprocessed. And if you kept that on the top of your list and focused on it, you would have spent time on something that isn't really valid anymore. So it's important that your snapshot is current in the last 60 to 90 days. Make sure you're looking at the top reason codes and exclude those non-covered service things, patient responsibility, RAC recoupments, contractual obligations, so that whenever you go in and you're taking a look at your denials, that it's really a good lay of the land. Once you've done that, you want to isolate each category into its own denial bucket. So you want to start with your top 4 reasons, put 1 reason in each bucket, or your top denial in each bucket. And why 4? Because you're going to tackle 1 bucket per quarter. And I'm going to suggest that you actually start with an easy bucket. It's going to help you with managing the change management process for your staff, and it allows your team to see results out of the gate and stay motivated. It's important that you break the problem into smaller chunks. It's really going to help with goal setting. We mentioned the change management piece, but it also starts to build in success early to the process. And you might be able to relate this to some of the sort of methodologies that you hear around some personal finance strategies, which is get an easy win and stay motivated. So step 4, identify your top denials. Step 3, focus on 3 reasons for that denial. So again, start of the quarter, you run your report, take a look at the information, focus on the last 60 to 90 days. For example, if you looked at coordination of benefits, you may find that you have reasons within that bucket around secondary claim submitted without an EOP, wrong payer responsibility, or the birthday rule, for example. You can also look at remark codes to help you when you start trying to bucket this information around the reasons. And those remark codes, a great resource for this is x12.org. You can go, they have a great lookup tool, and that can help you when you're trying, if you're not as familiar with those remark codes and you're trying to figure out how you want to address the reasons. The other thing about looking at the 3 reasons is take the committee approach. This is a time when ruling by committee works really well. It should be multidisciplinary, and it should be registration, coding, follow-up, payment posting. It could be clinical people, but you want to really bring everybody in who's got a hand in the revenue cycle. The key part here is to start with reviewing how the denial is resolved or worked. So it's really that time when you want to start at the end. Make sure you know what it takes to get that resolved. But the other part you want to focus on is make sure that the first action taken on the denial results in the correct payment. You want to try and understand that the first thing you do that gets the claim paid is what you want to focus on. You want to use specific examples during your review, but I will caution you here. Stay in that 80-20 rule to avoid getting into rabbit holes. And what I mean by that is you could have a very challenging denial come up into your committee. It's one claim out of 100. It's very challenging. It's hard to address, but you wouldn't want to derail your focus on being able to address 20 to 40 other denials to reduce the volume by getting stuck on evaluating this one for a long time. So I just caution you in the committee that is one area that you have to be aware of so that you don't get caught up into that. So step 3, focus on reasons for that denial. All right, step 2. We're going to look at implementing 2 options to address the reasons for those denials. So in the bucket of option 1, you would look at process improvements, being able to review and identify, starting first with your payer relationships. Make sure that you have a resource that you can review payer-specific rules and issues with. Take a look at your payer contracts. Sometimes even finding the contract can be challenging. So you want to make sure that you have the contract, you've reviewed it, and that you have the most current fee schedule. When you look at your registration processes and changes, make sure, are there things that you could be doing at registration? Should you be collecting a piece of information that you're not? Then review your system for any updates. Do you have an update sitting out there waiting for your system that may have new features that could improve your processing? And the last part here on process improvement is around charge entry and claim filing. Do you have a process to make sure you don't have lost charges? Do you know if you're having a leakage of charge entry or claim filing? Are you able to account for all your claims as they are filed? Option 2 is around tools that you can use to address your issues. So first thing you would do is maybe think about your current relationships with partners. Do an inventory. Do any of these partners have tools that you're already not leveraging? For example, contract management tools that can help you manage those fee schedules that are extremely complex and hard to keep up with. Do you have a claim editing tool, either through your host system that does your accounting or and claim filing, or is it through your clearinghouse partner? Are you able to add edit content to your claims processing? Is that, again, through your clearinghouse partner? Is that through your system? And we're talking about all the letters here, right? LCD, NCD editing, medical, that help around medical necessity. CCI, MUE, all of those different letters of editing packages. Those are usually in packages that can be adopted and applied prior to claims being sent out for processing. When you're looking at your eligibility processes, while you may be leveraging websites for eligibility, are there opportunities for your system to integrate and automate those processes? Are you getting that information put back in your system so if someone is doing registration, they can reference it? Now, the BI tools here and business intelligence tools that I'm referring to are usually some of the larger organizations are using a BI tool in which they're importing data in and doing analysis. It's typically used by finance groups and supported by IT, but you may want to look at these tool sets and see if there are additional report capabilities around denials that you can use to supplement other tools that you may be using. So that's step 2, implement your 2 options to address. Now here we get to step 1, right? So it's a countdown method. Step 4, 3, 2, and now 1. Apply one way to measure success. So when we look at this, you could set one goal for success. And some examples of this could include clean claim rates, denial rates, or days in AR. if you're going to use the denial rate, I'd make sure that you use a consistent formula to measure denials. I suggest using the HFMA denial rate, and that definition is published in the HFMA map keys, so that allows you to stay consistent of how that's being measured against the industry. Make it a game. Really, you want to create positive behaviors within your team and leverage the competitive nature of your team towards this one goal. Make sure that you're celebrating and sharing your success, whether it's through a partnership with a vendor. Sometimes they have celebratory programs where they can acknowledge your staff and team. You may have social media outlets for your team also. So you just want to make sure that you have a way to measure your success and that you're doing it publicly for your team. Now, we would suggest using the clean claim rate as your metric to measure success. And you'd say, well, what in the context of denials, how does the clean claim rate fit in there, and why is it important? A couple things really is, one, it's easy to measure, and that's always a great indicator when you can pull in something that's easy to measure. But this indicator shows a focus on being proactive when you start fixing errors further upstream or at the source. And we do know that clean claims equals fewer denials. So here we go. We're going to walk through an example. So I'm going to ask Jason Yachman to jump in here and to share his perspective with me to help demonstrate how we would use this strategy at Availity to help a provider group leverage the countdown method. So Jason,
thanks, Lynn.
at Availity, oh, I'm sorry, I was talking over you, but your team works with a variety of different providers, right? So health systems, billing services, specialty groups. But why don't you just help us walk through an example from your perspective on an academic medical facility?
Yeah, thanks, Linda. You're kind of like my Geek Squad, Revenue Cycle Geek Squad teammate. So I appreciate the exciting chance to walk through this with you today. And these are the types of strategies that we like to use to help our customers optimize their revenue cycle. So I appreciate the chance to talk to you about it.
Yep, I agree. Jason and I are both on the Geek Squad for Revenue Cycle. We do get very excited about it. So we're going to jump in here, and we're going to actually walk through a real-life example using the countdown method. So step 4, we're looking to identify the top 4 denials. And so we've looked at them, Jason, and we have duplicate claims, coordination of benefits, timely filing, and medical necessity. So what I would ask you, Jason, is what bucket do you want to start with and why?
Yeah, one of the things we love to do when working with our clients is just to kind of get into the data and really analyze and group and prioritize that, and try to figure out, what might be holding their revenue cycle back. And when I look at this list, these are some pretty common reasons we see. But what I love about the approach is, we're getting focused on picking just one, which makes it easier to digest and gives you the right approach for success. So I'd like to pick timely filing. It's typically one that we all kind of understand what it means, but we're not always sure what's causing it and maybe more importantly, how to prevent it.
Okay, great. It does feel a little bit like revenue cycle jeopardy that you wanted to take timely filing for 1,000 Alex is how we would say it, right? So,
right.
Well, it's exactly right. We pick the one bucket. We're able to run a report showing that the adjustment reason code that ends basically in a 29 is around timely filing, and we can look at the number of service lines that we that encountered this reason code over the last 90 days. So we have this real world example that we want to walk through. So here we go. Let's dive on into step 3. So we're going to take this one and focus on 3 reasons for the denials. So the next step is for us to drill into the data.
Yeah, so we encourage that kind of committee approach that you talked about earlier. Get that committee together, dig into those remark codes, try to get a feel for what's driving the highest impact and maybe what it might take to fix it. In this case, we'd want to obviously focus on the largest bucket, which typically represents a standard, data service to submission type issue. but also maybe the N111 and the N20, which usually result in some sort of duplicate claim type issue.
Right. So when you look into that timely filing bucket, we've run your data again. We refreshed the data, looked at the last 90 days. We're going to focus on, number one, that when the information is not returned, is that's really around the date of service to submission is past your contracted timeline. And typically, like I mentioned, the remark code's probably blank on your 835 for that, so the reporting may not bring that up with a specific remark code. We look at the N111, which is that the service was included in a claim that was previously billed and adjudicated, so you're thinking about duplicate claims there. And then also service not payable with other service rendered on the same date. So again, another flavor of a duplicate claim. So these are all three very good reasons for us to drill into and try and address this for timely filing. All right, so great. Now let's go into step 2, implementing 2 options to address. So Jason, in step 4, you picked the timely filing bucket. In step 3, we picked out 3 reasons that were causing that denial for that bucket. And now I'm going to make some suggestions about best practices that you can implement around those 3 options. So, first and foremost, we're going to focus on processes. Definitely going to be mostly around analytics and monitoring, and it'll be important that you have processes in place to identify and track what's going on with this bucket. That way, as you're making changes, these tools that you may be implementing that are going to help you, you'll make sure that you're going in the right direction and didn't throw in an edit that stopped too much, right? So when we start thinking about that process. So really what I'm going to suggest are a couple things here, and we're going to just click through these. So in the monitoring, we're going to suggest that you implement monitoring on your average dates of service to date of submission. So you could do this using a report from your clearinghouse, but you may also want to look at a report in your host system that's looking at date of charge entry. So then you start looking at each hop the claim is taking from date of service out to date of submission, right, and the date that it goes out to the payer, making sure that you understand how much lag time is in each one of those buckets. You may want to identify and isolate your primary and secondary claims because there could be different reasons influencing the lag time in each one of those buckets. Then you can schedule this report for delivery weekly and incorporate it into your denial prevention team reviews. So as part of this countdown method, right, you're going to be meeting with your denial prevention team on a regular schedule. So processes, all about monitoring, all about reporting. Option 2, we start looking at tools. So here we're going to talk about using an editing tool to create edits. And so when we think about this, you could partner again. We talked about doing an inventory of those partner relationships that you have, and is there a tool available to you either through your clearinghouse or through your host system? At Availity, for example, we do have a tool that people can use and write their own edits and implement those. And that may be the best kind of tool for you to use. You may also find that you don't have the skill set in your organization to use a tool or perhaps time. And then you can also reach out to your partners or your, whether it's clearinghouse or your host system, and try and do custom editing. But what we would suggest is that you create a payer-specific edit to stop claims to be reviewed based on the date of submission and the date of service. So you're looking for something that has a long lag time, and based on your reporting and understanding what those lag times are in each one of those buckets will help you decide what the edit should be. You may also want to create an edit to review for duplicate claims. And so duplicate claims can be a little challenging, but you'll want to determine for your organization what fields make a claim a duplicate claim, and that's what you would use in order to flag those claims. Depending on the type of system you use, your own processes. A duplicate claim could be one set of criteria for one organization and a completely different set of criteria for another organization. I'm also going to suggest, though, when you're implementing these edits, you take the crawl, walk, run approach. One thing you want to be careful about is overwhelming your team with new edits. So again, we talk about change management as a big part of this process. And also when you start moving things upstream, make sure that that team is resourced appropriately so they can handle the claim edits, and also that they know what to do when they see the edits. So when you're implementing, you may opt to just going for the top 3 to 5 payers as opposed to even a top 10. All right, so that's step 2. Now on to step 1. I think, Jason, this is probably both my and your most favorite part of the process, and that's when we get to the fun part, which is measuring success. So you suggested we use the clean claim rate, or I suggested that earlier, but I know you would support that. But we're going to suggest in your countdown method that you do use the clean claim rate, and that initially understanding you're going to see a drop in your clean claim rate. It's going to be one of those numbers you set out there and you want to measure against it, but when this is working, your claim edit rate your clean claim rate is going to drop because the issue is being pushed upstream. It's going to bring more visibility to this issue. But can you share more information just about how other organizations use clean claim rates across their orgs and how it can fit into a strategy around denial prevention?
Yeah, I do agree with you, Linda. I think the clean claim rate is a great indicator of performance, and although it's likely to drop, like you said, it generally corrects itself over time. And if you're, finding these things and moving them upstream and fixing them earlier, you're going to see a direct correlation in your denial rate. So it's a very important leading indicator and a good one to look at. I also think when you're benchmarking your performance, first you really have to know where you land on the scale, right? How do you stack up against your peers? Groups that are below 90% on their clean claim rate have lots of opportunities for improvement, and maybe there's some easy quick hits or wins in there that they can take advantage of and get some of that momentum going that they're looking for. Most customers kind of fall in that industry standard 90 to 95% range. They're doing a lot of good things, but they're looking for some sort of an edge to become a high performer. And there, like you mentioned before, are lots of tools and processes to take advantage of there. And then with your high performers, those that are pushing the envelope are already at a 98 or 99% clean claim rate. They know this is a game of inches. They know that they already understand that just a few tweaks can make all the difference. But they also know that it's a dynamic environment and things are changing all the time. So they'll continue to do the monitoring to make sure they make the right necessary adjustments along the way.
Yeah, that's great. And I do agree, it's the benchmarks, it's important that you have that laid out and that you agree upon it as a group as to what you're going to push for. And then you continue to monitor throughout the quarter for a reduction in the number of edits. Again, monitoring that one data element will keep the team motivated. And speaking of that, what are some ways that you've seen organizations celebrate or sort of, bring this, make it more fun?
Yeah, you know me, I love a good party. So yeah, we at Availity, we have this thing called Revenue Cycle Star. It's a great way for us to partner with our customers to put a spotlight on folks who are doing great things for their organization and promote that and share that. We've seen our customers do all kinds of fun activities and have internal competitions with rewards and raffles, and what's great about this approach is you've already decided what you're going to do and how you're going to measure it. So the most important thing to me, and the only thing really left at this point, is just to have a little bit of fun with it and see what you can do to keep the team motivated.
Yeah, I would agree. And I don't know who does not think revenue cycle isn't fun, but there might be some out there that need motivation, but I'm all about a revenue cycle party. So you know me. Okay, so we talked about the method. Look at 4 different reasons, your top 4 denials, right? So that you could bucket them into quarters. 3 reasons for each one of those denials. 2 ways to implement options to address it, and applying 1 measure of success. And so we talked about using the clean claim rate to measure the success, but we also have to do some math, right? And show how is this impacting the bottom line. So we're going to walk through the math here with you. So remember, we ran your real world data. We looked at it. There were, in those 3 areas that you wanted to focus on for timely filing, there were approximately 14,000 line items impacted, right? So you had 14,000 and 66 to be exact line items in those 3 buckets. I'm going to make an assumption that you've got approximately 6 line items per claim, and 50% of those could be prevented. So I'm actually being very conservative with the numbers here, right? That while many industry sources think that 80 to 90% of denials can be prevented, let's just say we set our goals pretty low. Remember, we wanted to have good success out of the gate buying to change management. So we're going to say that 1,172 of those claims per quarter, we could knock those out. We're going to reference that number of $25 to rework a claim from MGMA. Then we look at what that cost would be per quarter, approximately $30,000, $29,304. So the annual rework cost, or our savings there, are about $87,000. So I think it's important to show the math here. I think it's important that you see that you could show the math in a conservative way and really show an impact to the bottom line.
Yeah, Linda, I would just add to whether your numbers are bigger or smaller than what you see here, the percentage of impact is usually roughly the same. So I really feel like any organization can benefit from an approach like the countdown method.
Yep, I totally agree. So let's just wrap up here. I know it seems that maybe we've hit on it a couple of times, but I will say that we're pretty bought into how this method works. Again, the key to the countdown method is that it's focused, it's proactive, and it's repeatable. And the key is that it's about prevention, not just managing. So we look at step 4, identify the top 4 denial categories. Step 3, focus on the 3 reasons that cause the denial. Step 2, you're going to implement 2 options to address those reasons. And then step 1, apply 1 measure of success. So again, we just want to share with you, why would you want to keep managing things that you can prevent? And we'd encourage you to go out and get started. Before we jump in and take questions, Jason and I just wanted to share a little bit about our organization at Availity and share that Availity is uniquely situated in the market. We offer both tools and services to both payers and providers, as you can see on this slide. And we really focus on helping to build tools that fill the gaps between both payers and providers for a more efficient healthcare system. So we have been just very excited about talking to you guys today. I'm really excited about the Q&A part here, and hopefully we can work together to develop some solutions that really work to address this problem. So I think now we could open up for questions.
Yes, thank you, Linda and Jason, for that fantastic presentation. So like Linda said, attendees, we will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard, and we'll try and get through as many of these questions as we can today. So Linda and Jason, some questions have come in already. Let's see here. Here's one. I'll pose this for both of you, and then whoever wants to, actually, you know what, Linda, this is about something you had mentioned, and they just would like to confirm the resource you had shared. What was the website you mentioned for the remark codes? Was it, do you mind restating that website or going back?
Yeah, no, actually it's the x12.org. So it's just the letter x12.org. And once you're on the site, you can search for remark codes, or you can even just do a Google search, remark codes X12. And I find the site very helpful. It's a little search box that pops up. It has a complete listing there also, but like you can just type in like N111 and it'll pull up and tell you whether or not it's a warning or it's an actual denial. So it's a great site, and again, that was x12.org.
Okay, thanks, Linda. And thank you, attendee, for the clarifying question there. Okay, let's see, Linda, there are some others that have come through, and Jason, here's a question. What do you do if the payer rejects a claim that was correctly submitted?
Oh man, yeah. So that does happen, right? And that's where I think it comes into play around there. You have a couple options, right? So there's the reprocessing of a claim, and you can send it in as a corrected claim with a note. Many times you have to contact the payer in some cases and get them to do a reconsideration. Some payers have processes electronically that you can request reconsideration. I would also say that that's if you're having a continuous problem with this and it's high volume, that's when the payer relationships come into play. So we talked about the two options on step 2. One of those is taking a look at your payer relationships. And so having that point of contact where you can go to them and say, you know, look, again, you kind of reference your reporting. We've had to reprocess or call you, payer A. We've had to call you 10 times this month and have this claim reprocessed. When we call you, reprocess it, there's obviously an issue. I think the key to that is when you bring it to a payer to address that you have some data behind it and you can show them how many claims that they're having to reprocess, how many calls they're having to take for you over the issue. So I would just say leveraging your payer relationship, but also making sure you have the appropriate data to show how many times that's happened is helpful. I don't know, Jason, if you want to add to that.
Yeah, I agree with everything you said. I think the more prepared you are, the better the response will be, and getting access and that information ready to go is important. And I think you touched on the payer relationships. I would also add there that, you know, this is another opportunity to reach out to your partners, you know, like Availity and others, to see what relationships they may have with the payer, and are they able to help or assist in either collecting that data and preparing it, or even leveraging a relationship they may have.
Yep. Absolutely.
Okay, thank you both. This attendee would like to know, is there value in looking at non-covered denials, whether that's strategically, certain payers, certain RARCs, certain rev codes? Do you have any perspective on that, Linda or Jason?
I would say there is value at looking at that, but I would say it would be secondary. So I would say first, once the primary focus would be get in there and take a look at things that you know you can get some quick hits on and get some wins on, and make sure that you have a full understanding of your denials as a whole, meaning you know what your top 4 are, you know where you want to go and where you want to focus your team. And then I think you can start doing sort of these offshoot projects. And let's say your team gets really into this method and they're really on a roll. You may find that you shorten it down and you're able to pick a category or pick a denial bucket every other month. And or you may start to pull in, like you're saying here, you know, non-covered denials. Yes, I think strategically you could look at it and say, you know, what is causing it, because in a sense you are having to go through and administratively deal with that, right? Meaning you're having to manage in your system a code that you're having to flag for someone not to look at. So, or is there a way that you go ahead and initiate a write-off? But if you're writing that off, do you know the reason why? So I agree. I think there is good value in looking at that. I don't know that I'd flag it as the highest priority.
Okay, so secondary value, but still some value to that. Okay.
Yes, right.
This is probably another clarifying question, but this attendee would like to know, were the reports shown with the CARC codes from Availity?
Yes, so we did actually use real data from a real Availity client. So yes, that information is available in the Availity RCM. So if you're an RCM user or you use our RCM tool, that is information is available, and it's called our Remit Detail Report. So you're able to find it there. And if you have any questions getting to it, feel free to follow it with our support team. We'll help you get to the information.
Wonderful. Thank you, Linda. Linda, another question just came in for you as well. This attendee is posing to us, if we want to use our denial rate as our success metric, how would you calculate it? By volume or dollar, and what time frame?
Yeah, so I will tell you, there's a lot of discussion about denial rates and how you calculate them. I do find that HFMA site, so hfma.org, even though it's typically tailored for hospital organizations, if you're a professional billing organization or ambulatory billing, I think there is a section in there that will describe it. And they actually, the reason I love HFMA for this reason is that they have an area called map keys. And if you're not, for those that are available are familiar with HFMA, they're like, this is old hat to them, but it's a great resource to find. And it will actually give you the math equation of how to calculate your denials, and then it gives you definitions for each one of those data elements, and it will tell you what to exclude, what to include. And again, I think when I think of denials, you think about volume or dollar. I think you have to look at them both. And the reason that I say that, so if you're going to look at them as a measure, I will say the HFMA uses dollars. So the number of claims denied, total by the number of claims remitted, and then, I apologize, so they actually do use claim numbers. But I would look at them both, and you could substitute in dollars for each one of these values. And I think there's value in looking at both of those. The other thing that I would say is time frame. I would still stick to around 90 days, because as you're going through and making adjustments and applying a new process that's going to impact it, you don't want to spend your time working something old. And I feel like that something new could pop up and you don't want it to linger. So I recommend HFMA's map keys, their formal definition of how to do that. And you can get there from hfma.org, or just Google HFMA map keys, and you'll see they actually have a whole list and resource. It's a wonderful resource of different metrics that you can measure your organization against. And I would say when you do it, look at both. If they're way off as far as proportion, it would be interesting to see, do you have, a very high dollar procedure that's really throwing things out of whack. Boy, I got long-winded on that answer. Sorry about that, Molly.
No, detail is great, Linda. Thank you. And attendees, thank you so much for your questions. They're still rolling in, Linda and Jason. So attendees, if we have not gotten to a question you had in mind yet, please do feel free to submit it in the Q&A box on your screen while we have Linda and Jason with us. So here's another question that's come in. Let's see. Any recommendations on drilling into the root cause of denials? Would you have any do's or don'ts that come to mind, Jason or Linda?
So, Jason, you want to jump in here? I keep monopolizing the conversation, but you tell me if you want to jump in. I can talk revenue cycle and denials all day. So,
go for it. I'll jump on. I'll add to it as you or expand on it.
Okay. Yeah, I mean, when you're looking to drill into the root cause, I would say you definitely start with those remark codes. Again, many times you're not going to have a remark code, or you may not, it may be blank in that instance, so you're having to sort of drill into it a little blind. The one thing I would do is, so a couple things. Look for remark codes. We mentioned x12.org. The second thing I would do is I would ask your team. And here's a couple of ways I would approach this. When you ask your team, ask them what is their favorite type of denial to work. Now, take this into consideration, but typically people are going to tell you that their favorite type of denial to work is ones they can knock out of the gate and just knock it out really fast and they want to move on. Those are the ones you want to focus on, because those are not the ones that they're having to sit and go through multiple steps to get resolved. So, and we actually use this technique when we're talking to folks about claim edits as well, as what's your favorite claim edit to work? And it's usually all of us, I wouldn't say all of us, a lot of us love to look at a number and say, well, out of that 100, I can do 20 of these in like 10 minutes, and suddenly my list goes from 100 to 80 of things to work, and it feels really good. So it's going to be how you ask the question, but I would ask your team. So remark codes, ask your team what they like to work the most, and those will probably be the two areas that you would dive into the most. I don't know, Jason, you want to jump in there, but and agree or disagree?
Yeah, no, that's That's exactly right. I think it also underscores the importance of that committee approach, and you touched on it earlier around, bringing folks in from other parts of the, maybe less traditional areas of the revenue cycle. But you're going to find that some of the reasons that this is happening may be outside of your operational control or directly outside of your operational control. So inviting these folks in as part of the committee that influences the outcome, I think, is a critical component as you look at the root cause and trying to figure out, more importantly, what you can do to avoid it.
Terrific. So really tapping into your front lines perspective, asking about their favorite denials to work, their most favorite denials to work, and then also taking that multidisciplinary committee approach, Jason, like you said, to best practices for the attendee who asked about, drilling into the root cause of denials there. This question, I think I'll open it up again to both of you as I have, but have you seen impacts by providing payers access to medical records to prevent requests for medical records?
So I'll jump in here just from a product perspective, and this is not an easy question. So for our person who asked it, this is a very hot topic in the industry right now. Is how do you get past this denial? Because as a provider or an organization, a healthcare facility, I know that when I file this claim with this particular scenario, payer A, you're going to come back and ask me for information, right? And so we refer to that as the attachments space, right? So there's a transaction specific around attachments called the 275. And there's two different kinds of attachments that we think about. One's called solicited and one's called unsolicited. And the solicited is when a payer has asked a provider for information or documentation related to a claim that the provider can then respond electronically using this 275 transaction. What we've seen is that there is a lot of discussion around this, and I will tell you, COVID actually, I feel like, accelerated these conversations with both payers and providers, is that when we were in our normal day-to-day working out of a billing office, or you had a CBO or whatever your kind of workspace was, you had the ability to just, this is difficult, let me just drop this claim to paper, I'll mail it off, I'll send a letter, or I'll put it in the mail and people will get what they need. That really, that whole game changed when we went work from home, as most organizations did for their billing offices. So I'll go back to this question. Are you seeing impacts by being able to send, have providers send payers medical records before they ask for it? And what I would tell you is some payers aren't ready to do that just yet, that if you were to send it before they ask, they don't have triggers in their system to know that you've sent it. So they'll probably still deny it again, and you end up sending it twice. What I would say is we're starting to see payers try to address it. They're typically starting down the path of taking electronic first, and that they want to do that through an electronic path of taking it when they've asked for it. So if you think about a crawl, walk, run approach for them, it's really that crawl, walk, run is they want to still ask you for the documentation, but they'd like providers to respond electronically. Then they make sure they can process that through correctly. Then what we see them migrating to is being able to ask for it electronically. So through claim status, they're going to send you a request and say, send it. And then you respond 275. And then the third piece we're seeing them try to get into is they know up front they're going to need it. They would like edits triggered at clearinghouses, or that the provider is able to do it unsolicited. So I would say we're starting to see that happen. It is a little slow. I've seen a lot of movement in it this last quarter, and I expect as we head into next year, you'll see a lot of that. I don't know. I hope that answered. That was a very long question too for me, an answer.
Well, Linda, I appreciate in these Q&A sessions, more detail and the thoughtful responses always appreciated, so thank you very much. Attendees, we have a handful of questions left for Linda and Jason, and if we do not get to a question that you had asked, our panelists will be following up with folks after this webinar concludes. This next question is, what do you think is the best process in trending proprietary denial codes from paper remittance?
Oh, man, paper. We just talked about how bad paper is. So there's a couple of ways that I think you can do this. Many of the providers that we work with use an EOB to ERA conversion tool, are a partner for that. So that is whenever you're getting paper remits. So I'm going to tell you two different approaches here. Is I think you could take, look for a vendor partner that will convert your paper correspondence from a lockbox over to an 835, and during that process, you would go through a crosswalk exercise so that those proprietary codes are getting mapped to more of an ANSI code, and that will be a process that will help you in tracking that. So you can sort of go down the partner using a tool and partner with a vendor that does EOB to ERA conversion. And that's taking that paper, creating an 835, they're creating a crosswalk, and you're going to auto-post that, and you could track it that way. If the partner relationship isn't part of a tool that you want to adopt or something that you would have the access to, you could create, I would say you could create your own crosswalk. One, I would classes do these highest to low volume. Start with one payer, what's your highest volume, create a crosswalk for it, and then map those categories into an ANSI code within your system, and then know that you need to report on that particular payer on a more regular basis so that you could track that. I don't know, Jason, if you'd have any other thoughts about that. That'd kind of be my take, the tool and then a process change.
Yeah, I think, the process around, analyzing that paper and crosswalking it yourself is right to do in a bite-sized format, focus on the high volume. And then, one of the advantages, again, of having an EOB conversion tool gives you that normalized reporting that we talked about, too, so you can see that information as well as your traditional 835s. And maybe there's another opportunity to look for ways to just increase your 835 consumption altogether. There are lots of ways to go direct to a payer to get that 835 information, even in other formats that may be better than just paper itself. So that's the kind of thing I would focus on if that's driving a lot of paper, and the review of that paper becomes cumbersome. There may be advantages or things you can take advantage of there as well.
Okay, thanks, Linda and Jason. The sixth question is, are there any resources you would recommend for fighting out-of-network denials?
That is a tough, the group is good, man. They're sending us no softball questions on this webinar today. That is a tough question. I would say, as far as resources go, I don't have like an organization off the top of my head. I actually will take this question back to our team and see if there's any recommendations. So Molly, if we and our Availity team will flag this particular question and try and see if there's any resources that we would recommend because of out of network and how that is can be a different process. I don't have anything off the top of my head, but we would be happy to do some research and try and make some recommendations. I don't know, Jason, if you guys have seen any of that on your side of the operations house.
Yeah, I think it's a good one for us to take back to the team. My guess is that our account management staff working with our organizations have probably had those discussions, so we could probably articulate a good answer from just reaching out to them.
Yeah. Okay. Well, on behalf of this attendee, we appreciate it. You'll take it back to the Availity Brain Trust and be in touch.
Yeah. Good question, though.
So Linda,
that's a tough one, but it's a good one.
Yeah, lots of good questions coming in. This is great. Linda, I think this next one actually is on the heels of your prior remarks about asking your staff what their favorite denial is to work. This attendee would like to know, I was under the belief that the most common denial is due to missing information. Is that not true? Can you weigh in on this one?
Yes, I can definitely weigh in. And, here's what I'd say. It could be for your organization that it is your most common denial. So, you know, it really does vary based on the type of organization that you are. So, and here's what I would say is, so if you're an organization that is pediatrics, or you're maybe you have an older population, Medicare population that you care for, geriatric based, either one of those very well could see that their top denial reason is coordination of benefits. Maybe a Medicare beneficiary also has Medicaid as secondary and it gets kind of out of whack, or it's the Advantage plan gets filed or doesn't get filed. And the pediatrician, it's about the birthday rule. You know, both parents have coverage and who gets filed first. It's very possible that in their particular, this person asked the question, in their organization, that it is missing information. And the reasons for that, again, you dive into the three reasons for that. It could be around certain procedure codes. Maybe it's when you say it's missing information, sometimes that could be that if you're in a where you're doing procedures, it could be the modifiers are off, or could be the order of the claims being filed, or it's an assistant surgeon. So there's a lot of contributing factors that could be there. So when we say it's the most common denial reason, it very well could be. It's definitely going to be in the top 5 for most people. The key is going to be, what is the cause of that denial for your organization? Is it because you're you're doing reads of a radiology procedure and you're also billing for the technical, the actual performing of the procedure and the reading? So in the common bucket, yes, it's going to be in the top. It's going to be the reasons that you drill into it that's going to determine how you can take action on it.
Okay, thanks, Linda. And then we probably have time for this might be our last question. We're definitely down to probably our last 2. So Linda and Jason, thank you so much in advance for all the insights you've shared in this question and answer session of the webinar. This attendee would like to have some tips about big data sets. So the question here is, do you have any tips about, any tips for analyzing large raw data, finding trends, other than pivoting by denials category?
Yes, so the way that I would approach it really is, and I am a big Excel fan, so I love a good pivot table. So, I mean, it's like pivot tables and RevCycle go hand in hand, right? But when you think about it, I would say the other slicers that I would add to it are going to be your provider and your payers. And the reason that I would say that is that take a look at your top 3 to 5 payers, pull those out, and then drill into them maybe one at a time. Again, not overwhelming with the data, but so you're looking at 3 to 5 breakouts from that. Also look at your most productive provider and see who bills the most and focus on them, or go the other approach and pull in your provider who's having the most problems. So when you're looking at these large data sets and you say, well, it's just denial category, you could break them even further into just top 3 to 5 payers, top 1 to, depending on your size, top performing provider, or maybe even your worst performing provider, and look at it that way. I agree. I mean, what the user's question really to me is getting at is, how do you get these really large data sets and start finding something you can action on that breaks it into these buckets that you can get your team to ingest and not be overwhelmed by. So I think adding an additional slicer by provider and payer can help with that, and make it into chunks that you can more easily consume.
Yeah, Linda, I would add to that. I 100% agree on the provider and payer approach. And maybe there's an opportunity to even eliminate some data. We see obviously a lot of eligibility related issues, and sometimes, again, operationally those are challenging. So you never get to some of the other stuff that might be easier, maybe eliminating some large sector or chunk and then focusing again on the countdown method with a smaller, section may be easier as well.
Okay, thank you both. And That concludes the question and answer session of today's webinar. So attendees, thank you very much for your thoughtful questions today. If Linda and Jason were not able to address your question the time we had, they will be following up like I had said. So thank you for your remarks and for joining us for this webinar today. I also want to thank our presenters, Linda and Jason, for your excellent presentation and for Availity for sponsoring today's webinar. On behalf of Beckers, enjoy the rest of your day, and we look forward to having you join us for future webinars.